Hi, my name is Grace,
I'm Caitlin.
And I'm Emily.
and our research topic was determining clinical experience readiness of first rotation doctor of physical therapy students based upon current practicing clinical instructors. Originally, we wanted to take on the challenge of why clinical sites prefer to offer spots to second and fourth rotation students the most. The grand plan was to determine what these sites want from students, what are the foundational skills they deem necessary for a student to succeed, and then how does this information translate into a course curriculum, not just at Dominican College, but at other Northeast programs. We wanted to prove that the schools prepare their students enough for their more challenging sites, or vice versa, maybe some sites aren't geared towards clinical success of a student. I'll explain more why this became an uphill battle for our group and how our research project has evolved since its initial thought. The purpose of our study was to lay a groundwork that would be useful to prospective and current students in inpatient and outpatient settings for clinical success in their site.
So initially our group had 2 phases of our research. However, up until recently, we had to adjust and keep it to 1 phase. We will explain more of this later on. So the methods of our research, minimally required skill set, was dissected by the 3 of us, unanimous decision on what skills to keep and disregard for first rotation students. We determined that the basis of those skills specifically by the capstone rubric. Surveys were given out by paper and online mediums to current practicing clinical instructors who ranked these skills on a 5-point Likert scale. Goals were to be determined a difference in inpatient and outpatient skills, and then we wanted to collect a course objectives of different programs to the Northeast cross-reference for the skill determined important.
The strengths of our studies include how we had multiple forms of surveys. Participants did not require our supervision to complete our survey, especially since we used SurveyMonkey as well. The statistical calculations were easy to compute, and that as researchers, we were very enthusiastic about our research topic. Some weaknesses of our study include the chain and clarity of communication with our research group. Because our topic consisted of 2 phases originally, some ideas were confusing to grasp. Phase 2 of our research was supposed to include comparisons between other DPT programs. However, due to the reluctancy of other programs to participate, this phase was no longer tangible and required further alterations of our project. We also had difficulties with eligibility of some completed surveys because some participants did not meet our inclusion criteria. Another weakness is that there is not a lot of prior research in this area, which made it very difficult to create our methods.
The opportunities that our research will provide are betterment of our future clinical education. It can provide insight for program structure as well. It can aid in clinical availability and placement for first-year students and overall evaluation of the student. For our group specifically, it helped with networking. We are still looking into convention possibilities, and we are excited to see if our results are consistent with a task force that has been recently conducted.
Threats to our research were cooperations of other DPT programs, DCEs, for example, we had to eliminate that portion of the study, therapists with their honesty in answers, difficulty collecting anticipated amount of participants, especially with inpatient, the lack of confidence some of our researchers had, and time constraints. Some tips we have for the class of 2020 is start early with your methods, your research, all of it. Be firm with your research groups on what you want to do. Know when to adjust. For us, we had to let go of phase 2. And don't be afraid to ask for help and be persistent when getting data.
So we would just like to say thank you to all the DP staff, particularly our mentors and Dr. Adair for all the help that you guys have had, and to our classmates and you guys for all of your help collecting all the data and giving all of our surveys out to people, and we give Dr. Adair permission to use this presentation to show you guys.